Homologous recombination repair (HRR) gene mutations result in homologous recombination deficiency (HRD), which is associated with increased risk of high-grade serous ovarian cancer and subsequent response to poly-ADP ribose polymerase, or PARP, inhibitors. Today, no standard composition of what comprises an HRD test panel or testing method exists, prompting the need to understand HRD testing in high-grade serous ovarian cancer to inform best practices and optimize HRD testing in the clinic. Diaceutics assess the testing landscape for determining HRD status in ovarian cancer using a dataset of 8,400 newly diagnosed and metastatic ovarian cancer patients using its proprietary Global Diagnostic Index. Germline mutation testing rates were 3 times greater than somatic testing rates. 67 labs offered comprehensive solid tumor next-generation sequencing, or NGS, panels capable of measuring HRD with varied HRR gene target composition. 3 labs currently offering panels explicitly intended for HRD determination only included BRCA1-2 and at least 1 genomic instability marker. For example, loss of heterozygosity, large-scale state transitions, or telomeric allelic imbalance. These results demonstrate that the lack of standardized HRD test panels is leading to poorer outcomes for missed patients eligible for PARP inhibitors. Diaceutics recommends that organizations such as ASCO, CAP, or AMP establish defined universal HRD testing panels and educate stakeholders in order to aid harmonization and, ultimately, improve treatment outcomes.